All right, you were at the gym a couple weeks ago and you tweaked your knee. You knew it wasn't good, so you took a couple days off. And now it's been a couple weeks and it's still hurting and you got to do something about it. So you got a couple options. One person you might go see is an orthopedist. But another consideration might be you might see a physical therapist. And I think a good rule of thumb to think about is minimum necessary intervention. You don't want to be going to do extreme things if you don't have to. So consider the tools when you're deciding what to do. As a surgeon, your options are an injection or surgery. And don't forget, even though most people that go into healthcare are helpers, it is a business. And if a surgeon can't do surgery or can't do an injection, they really don't have a lot of information for you. Of course, they can do imaging, which can also be helpful, but we're finding that maybe it's not as useful as we once thought. After a certain age, you're going to find some arthritis. You're going to find something if you go looking for it, but does that mean it's your symptoms? And are you going to use their tools to fix that? If surgery is not an option and you don't want an injection, which there's some drawbacks to those. Even we've shown that it can actually speed the arthritic process. So you don't want to go using injections, although there is a time and place. You don't want to be using those unnecessarily. So this is my rationale that you might consider using a physical therapist first. If you didn't have a traumatic injury where a bone's popping out or you think there might be a fracture, you might consider a physical therapist. We've been trained to at least screen for those things. There are very common characteristics of different different injuries, and they can screen for those. And if something just doesn't seem right, you can always ramp up the intervention and go see an orthopedist. But if your first line of treatment is not going to be an injection and it's not going to be surgery, consider a physical therapist. Consider our tools. Manual therapy, which might be some joint mobilization, some massage, even just to relieve pain. I think that's really valuable to get you back towards function. Other than that, what are the things that led to the injury? Probably a movement problem. And physical therapists are trained in movement, where orthopedists really tend to look at imaging. I don't know if you've been to an orthopedist lately. Most of the time you don't get much face time with them. They're going to do an image, they're going to look at that. They're probably not going to spend a whole lot of time talking to you. And they're going to make a decision, can I do surgery on this person? Or do they just need to wait? And basically, if they can't do surgery, usually some might suggest doing some physical therapy. A lot of them just say you're fine and rest, walk, swim, things that are kind of low impact. But is that really getting you back to what you want to do? And I really think physical therapy is an excellent option for non-traumatic, chronic issues that surgery and injections are not a tool for. So you'll go to a physical therapist, you'll probably get 45 minutes to an hour with the person. They're going to look at how does the knee interact with the ankle, how does it interact with the hip, how does that look in the movements that you typically do, how does your movement break down in other areas relate to what's happening at that knee. And then they can give you some tools that might help get you out of that situation first, just to get you out of inflammation. Maybe you do just ride the bike for a period of time to get that cyclical motion to flush the knee of all that inflammation. But once the inflammation subsides and maybe even the pain subsides, what are you going to do about that? If you don't want the thing to come back, you need to be proactive about doing something about it. And that's where some manual therapy, some exercise, even some modalities that get a hard time might be helpful. So I would argue physical therapy is a great first line when you have an issue that doesn't seem to be healing, versus an orthopedist who is mostly going to be looking to do surgery or injection. Thanks for watching.